We are back, recording live from the CHNC. We're not totally live, we're pseudo live, but a topic that is near and dear to my heart. We've got Dr. Melissa House from CHOA, neonatologist, Chavis Patterson from CHOP, a psychologist, and Kathleen Stanton from Dell Children's, also a psychologist. Welcome, you all. Nice to have you.
Thank you for having us.
Yeah, thanks.
Thank you.
So I just want to highlight, you guys are leading a workshop tomorrow afternoon entitled Combating Distress, Dissatisfaction, and Discord, Creating a Psychologically Minded NICU. Wow, there's a lot to tackle in one 2-hour workshop. But before we really get into the nitty gritty of the workshop, tell me a little bit about why it's important that NICUs even have mental health professionals, especially psychologists, but at any level, at least a mental health professional.
I'll let you all take it.
Should I start off? All right. So I'm at the Children's Hospital of Philadelphia, and I'm one of a couple of psychologists that we have embedded in the NICU or work in the NICU. And again, the NICU is a highly stressful environment, both for staff,
right?
for staff and for families. And we realize that it's a traumatic journey for parents, and we feel like to support them through their journey as well as take care of their baby. So there are a number of, there's a group, an organization, the National Network of NICU Psychologists, who are made up of psychologists that work in NICUs across the country. And we talk about what we can do to support families, what we can do to offer staff different tools and techniques to support those families, and also talk about how to support staff. Again, it's a traumatic environment, and everyone, feels the ripples of, the baby being in the NICU.
Absolutely. Anything to add?
Absolutely. I mean, I think as I'm the first psychologist present at the Dell Children's NICU, and I think one of the things that was noted was just what happens when if that role isn't present, then everyone else ends up taking on that role. I mean, people do anyways, because that's just, healthcare providers have a lot of heart and have a lot of care, and it's hard for them not to care. But I think the more they realize that there's someone else that can hold the caregiver's well-being with them and in a different way, that kind of takes some of the load off of the rest of the staff. And then I think also just like the consultative role. So at Dell, we have interdisciplinary psychosocial rounds weekly where we round on each of the families. And it's just an opportunity to kind of look at families from multiple lenses and have like that cross consultation where you're translating psychologically minded language. So just like feelings talk.
That's great.
And like thinking about that in context of things like feeding or, decisions that are really tough to make, like whether or not to have a G-tube surgery, which often seems very simple, but it can be very emotionally laden.
And now, Melissa, maybe as the neonatologist, can you talk about, so I've worked in lots of units without mental health professionals, but what is it like to work in a unit that has good mental health support?
So I've also worked in a variety of NICUs with a variety of mental health support. And I really notice a difference, I think, in the families having a partner on the team that can really help not only support them, but also be a liaison sometimes between them and the medical team. I've had them help really facilitate in care conferences, and not necessarily as a bridge for decision making, but in kind of bringing to the table and describing the ways that families have explained how the decision is making them feel or why they are struggling with it, and really helping the care team understand why, and us being able to better meet the family's needs or explain in a way that can really help us, come together and bring care forward. So I feel like it's really become, instrumental in helping support families, but also bridging, a huge care gap between not only the caregivers, but also the providers. And I've really noticed, a difference also in the staff and staff support and what, good mental health support can do for all of us. But having that safe space of being able to have a place to talk about it, but also better collaborate with each other and better understand each other and bring our best selves to the day, and understand why someone might not be bringing their best self, and learning how to better support them too. So I feel like it not only helps with the caregivers, but also just the general feeling of the unit and collaboration with the care team too.
I love that. I think I want to underscore, again, a personal passion of mine, that this is not a nice thing to do for families. This remarkably changes outcomes, both for patients, their family, everybody, the patients' families, and healthcare professionals. And there are some guidelines for that. I think people think some units are just doing it willy-nilly, but the nationalperinatal.org had a really nice publication. I was spending time pulling that up because about mental health in the NICU. And they have a number of handouts that I think are really valuable. And I especially like this 2015 publication in the Journal of Perinatology, Recommendations for Mental Health Professionals in the NICU. I think it lays it out in concrete, very easy detail. I hope one day this will be the standard of care, the minimum standard of care. And I'm just going to put in a plug. We have a multi-part series coming out in the Journal of Perinatology about mental health in the NICU, and lots of psychologists, NICU psychologists, were a part of that upcoming publication. So tell me a little bit about what the workshop looks like. What are the take-home points? What are people going to learn?
Great question. So yeah, it's a big topic, right? What is the psychologically minded NICU? So some buzzwords you're going to hear talked about that I think a lot of folks have heard about are trauma-informed care, moral distress, acute distress, care for the caregiver. We're going to be talking about each of those topics, but we're also going to be going through some cases and having people actually feel it and move through the process of what it is to do some of it, to get a little taste of it. In 2 hours, you can only do so much, but we're hoping that there's also space. We're going to make space to reflect on what's already available at people's current hospitals, but also what they imagine needs to be available or they want to be available, and then what they can as an individual do. Yeah.
And I think we're going to use sort of a number of different methods. We're going to do small group and large group. We hope to have some interactions using sort of immediate polls to get folks' responses, just to really get them involved, as Kathy said, to get them involved in the process, to really think about what it would be like for them to answer these questions and to walk through this.
And if people could take away kind of just one thing from the workshop, what do you hope they leave with?
Yeah. So we kind of crowdsourced as a group of neonatologists and psychologists that put this together. We were like, what do we all collectively think a psychologically minded NICU is? And there were these big kind of points that came out of that. So, and I'm going to, forgive me if this is a little scripted. It was not scripted, but it took us a while to kind of be like, what does this actually mean? So one of the big ones was acting together to create a safe and supportive environment where staff, infants, and family well-being is equally valued. So elevating the well-being and the importance of every being. Appreciate how moral distress, acute distress, and trauma influences the care we provide infants and their families. And then the big one is to elevate our sense of humanity for everyone, including ourselves. And that kind of piece of self-awareness, that it kind of starts with our own self-awareness, emotional intelligence, compassion for ourselves, which actually helps us to build empathy for others. And there's a ripple effect. So that's, that kind of culture of embodying it in the self is what kind of creates the ripple effect of having it as a culture among the unit. But I'll let others also talk about what they'd like to.
I know you could summarize it better than that. I think about the message to leave with. So there's a quote, and I wish I could remember who said the quote, but it's not my quote. And it just talked about how working in a NICU environment is very difficult. It's difficult for the staff. It's difficult for the families. And the quote was to imagine that you can walk through water without getting wet. right? As an employee, as a health provider, you can be in the NICU and not have it impact you in some way on some level.
Yeah.
So know that it can impact you and know that it's okay to reach out for help and that there is help available for you as a staff person, but also, for you if you're a family member.
I love that.
No, I agree. And the entire time that I've been thinking about it and putting together this workshop is really just normalizing. I think everything that we as caregivers, not only the parents, but as care providers go through on a daily basis, and normalizing that there are those acute stresses we see, but also those chronic stresses, families requiring a lot of our time, a lot of our energy. And so normalizing that we all do this every day, and that's okay. And it's okay to feel that, and then to know, like, okay, now how do we move forward and support each other in that?
Yeah, I love that. I think the best way we can take care of patients and families is to be taking care of our staff and ourselves first. So I think that's incredible. Thank you all for the amazing work that you're doing and for stopping by today.
Yeah, thank you for your time.
Pleasure.